Hey amigos, nice to see you again. Let's enjoy Dr. Y chest radiology. I'm Dr. Y, chest radiologist, medical professor in South Korea. Today we will talk about the ground glass nodule, session 35 GGN. Let's go. Hello Dr. Y, I have a question. What is the ground glass nodule? Why is that ground glass nodule so famous, even so much notorious recently around the world? Yes, let's go together to find out why the ground glass nodule is so famous, so notorious, and even so important. Let's start here. This is ground glass. Upper portion, this is normal, 100% transparent glass. We see everything through this glass. But below glass is half transparent. This is ground glass. This is ground glass. In the thin section chest CT, we see sometimes something similar with ground glass on the left side. This is ground glass nodule. Other area is normal lung, normal intact lung. How about this film, left side chest radiograph of a middle-aged woman? What do we see? What's wrong with this patient? Right side is looking okay. Left side is also looking nice. Where is the pathology? And let's go to the chest thin section CT of this patient. Right lung is normal, and we see a ground glass nodule here. That's the point. We can see the ground glass nodule on the thin section CT, but usually we don't see any on the chest radiograph. Do you happen to know the song named CXR, the Spanish word meaning what will be, sung by Doris Day? I like that song very much. Not only the melody, but also the meaning of the CXR. That meaning is it can become something, anything. That kind of meaning of positiveness. Positive, not negative. What will be, will be. Do you see anything wrong with this chest radiograph of old woman? Do you see something hazy density in the right upper lobe? Maybe you can see, or maybe you cannot see. But in the thin section CT, we see the 3 centimeter ground glass nodule here. This is the ground glass nodule. Que sera, sera. What will be, will be. What is this? Before entering the new horizon of ground glass nodule, I advise you to review the previous sessions. Session 13, lung cancer, 폐암, 하이간. 15, adenocarcinoma, 폐선암, 하이생간. 33, solitary pulmonary nodule, 폐결절, 하이게세츠. Now, let's get into the gate of the ground glass nodule. Fleischner Society defined the ground glass nodule as like this. A ground glass nodule manifests as hazy, increased attenuation in the lung, not obliterating bronchial and vascular margins. B. Part solid nodule consists of both ground glass and solid soft tissue attenuation. Comparison. Consolidation. This is the homogeneous increase in pulmonary parenchyma attenuation, obscures margin of vessels and airway walls. We all remember the 3 nodule types in the Chapter 33, Solitary Pulmonary Nodule. First, solid nodule, like this. Solid, very solid. 2. Pure ground glass nodule or just ground glass nodule. This one, pure ground glass nodule. Number 3, part solid nodule. Basically ground glass nodule, but somewhere in the nodule there is a solid component. This is part solid nodule. We call number 2 and number 3 together as subsolid nodule. Maybe, or actually, we are already familiar with the ground glass nodule. So, in this session, just enjoy another scenic drive of session 35 of National Park. Let's go. Two different images of thin section cities are here. This one on the right side, ground glass nodule. And this one on this man's left side, the ground glass nodule. These two people are different. These two pathologists are different. These two people's fate are different. One is a transient inflammation, so-called reflux syndrome, and the other will be lung cancer, adenocarcinoma. Doris Day's voice is still ringing again my ear. Que sera, sera. What will be, will be. Let's look closely in the magnified view. This person A's ground glass nodule. This person B's ground glass nodule. Do you see any difference? Any characteristics? Do you see any clue of these people's pathology? I don't neither. What shall we do? That's why these two people need follow-up. Follow-up is necessary. Subscribe. Thank you for your warm heart. What causes the ground glass nodule? There are many potential causes of ground glass nodules, such as infection, inflammation, benign tumors, and finally lung cancer. Some will disappear, some will persist over time, and some will turn out as lung cancer. Maybe this slide is the most important slide of the session. Why ground glass nodule so important? Because about 20% of ground glass nodules and 40% of part solid ground glass nodules gradually grow or increase their solid portion, where others remain stable for years. Persistent growing ground glass nodules are more likely to become adenocarcinomas or pre-invasive lesions. What shall we do if we meet subsolid nodules on the chest CT? That is the guidelines of Fleischner Society. A single lesion, single ground glass nodule less than 6 mm, no routine follow-up needed. Single ground glass nodule more than 6 mm, CT follow-up at 6 to 12 months. Then, if persistent, CT every 2 years until 5 years. More than 6 mm of part solid nodule, CT at 3 to 6 months. Then, if persistent and solid component remains less than 6 mm, annual CT until 5 years. When the ground glass nodules are multiple, what shall we do? Basic principle is almost same, but we have to more focus on the most suspicious nodule among the others. The person below the age of 35 is excluded in this guideline because the possibility of cancer is low. And who are the high-risk groups? Older age, heavy smoker, and the nodule characteristics are irregular or speculated margin and upper lobe location. Tobacco is a terrible guy. Don't smoke. Just don't smoke. This is what the famous actor Yul Brynner said to us when he was dying at the age of 65 due to lung cancer. He said, "Don't smoke. Just don't smoke." Indication for biopsy or surgical resection of ground glass nodule is like this. This indication is slightly variable according to the countries, but the basic concept is very similar. Number one is big. Big ground glass nodule is dangerous. 2. Getting bigger and bigger along the time is dangerous. Number 3. Growing solid component that is also needed to be biopsied or surgical resection. If you or I have a ground glass nodule in the lung, then the doctor asks to us, "How long have you been smoking?" We say, I say, and you say, "I don't smoke. Actually, I'm never smoker in my life. Why me?" The possibilities are, this is not accurate, just presumption. May have been affected by 1. Indirect smoker. Maybe father, maybe husband. B. Worker, restaurant kitchen worker, long been restaurant kitchen worker. C. Exposure to other carcinogens, which we do not know. D. Telling a lie to the doctor, because we are former smoker. We are ashamed to say that I am a smoker. Let's trouble who is showing the ground glass nodule. First, Referral syndrome. This is a disease in which eosinophils accumulate in the lung in response to parasitic infection. This is a kind of eosinophilic lung disease, ELD. X-ray, this lesion shows migratory pulmonary infiltrate as a ground glass nodule. In the CBC blood count, there is usually eosinophilia. This left side film is at the time of initial diagnosis. What do we see? Yes, left side is normal. Left lung is normal. What's wrong with his right lung? Do you see something here? Some ill-defined nodules or ground glass nodule? After treatment, there is nothing left here. Yes, this is normal lung of middle-aged man. Yes, this is after treatment, normalized lung. What's good news is he is not lung cancer. These 6 cuts of chest thin section CT images are what happened during the period of treatment in his lung, previous man's lung. Upper 3 cuts are initial, lower 3 cuts are 2 weeks later. Let's go first. Right lung ground glass opacity. A lower level, also another ground glass nodules in the right lower lobe. More lower level also shows the ground glass nodule here. After 2 weeks, another CT. Previous ground glass nodules are all gone, nothing left, but new ground glass nodules came out. These on the left side, this ground glass nodule. So that's why we call it migratory infiltrate. This is the migration of the infiltrate. Middle-aged woman came up with a cough and sputum, but her chest radiographs showed nothing. No abnormal findings on her left and right side lung of chest radiograph. But in her thin section lung window setting CT, we see ground glass opacity, 3 cm ground glass opacity in left upper lobe. This is a slightly lower level ground glass nodule. These ground glass opacities are all gone after antibiotic treatment. Actually, this is a lucky case of ground glass opacity compared with adenocarcinoma. Let's see another famous image of ground glass opacity, not ground glass nodule. Almost all of her lung zones are paved with ground glass opacity, bilateral, subpleural, diffuse ground glass opacity in the thin section CT and also on the chest radiograph. Diffuse ground glass opacity with air bronchogram on both sides of the whole lung. This is that famous COVID-19 pneumonia, typical face of the COVID-19. Ground glass nodule is evaluated by thin section CT. That means thickness of less than 1.25 mm. Not by chest X-ray, not by 5 mm thickness chest CT, even not by the PET CT. I think you remember this table of the classification of adenocarcinoma by IASLC, ATS, and ERS consensus. From up to down is adenocarcinoma going heavier, going seriously. The lighter one is pre-invasive lesions such as atypical adenomatous hyperplasia or adenocarcinoma in situ. What we expect most of ground glass nodule is this form of light adenocarcinoma. And sometimes we meet this minimal invasive adenocarcinoma with ground glass opacity. And invasive adenocarcinoma is usually appears in the solid form. Let's experience the ground glass nodule of adenocarcinoma. This is adenocarcinoma with a pure GGN, 2 cm pure GGN. But this is big ground glass nodule. So we have to pay attention to this kind of ground glass opacity. This is adenocarcinoma. How about this ground glass nodule? We have met before, telling you about the CXR. Yes, this is adenocarcinoma. At first, it was not big, but 2 years later, 2 years follow-up, it's getting bigger and denser. That's getting bigger. That is dangerous point. This is ground glass nodule confirmed as adenocarcinoma in situ with 60% of rapid growth pattern and 40% of acinar growth. And how about this one? In her right lower lobe, there is a 1 cm pot solid ground glass nodule. On her left side, this is a calcification of tuberculosis with surrounding ground glass nodule, ground glass opacity. This is TB scar, and this is ground glass nodule of adenocarcinoma. This ground glass nodule has solid components. That is dangerous. This is the most important, the most dreadful image of ground glass nodule. What do we see with his chest radiograph? Yes, left side is normal looking. On the right side, what do we see? Somewhat hazy, somewhat small, looking abnormal, or somewhat TB skull-like density here. Small skull-like density, small ground glass nodule-like density here. And on her thin section CT, we see 2.5 centimeter ground glass nodule with solid component. Very large solid component. In this case, we can say confidently, yeah, this is bad guy of adenocarcinoma. This means growing solid component, part solid ground glass nodule of adenocarcinoma. Maybe this is the last slide of ground glass nodule. How was your scenic drive of session 35? Was it scenic? Was it interesting? I hope so. Like, subscribe will make your next session wonderfully by Dr. Y. Thank you very much and have a wonderful time.